our dear viewers, and welcome to a new edition of our program, Africa Today. In today's edition, we are going to shed light about the latest developments concerning the COVID-19 in Egypt, and that in light of the recent press conference which was held earlier by Minister of Health, Dr. Hala Zayed. Minister of Health, Dr. Hala Zayed, said that the first phase of COVID-19 inoculation campaign is underway. Zayed was speaking at the press conference with the head of the scientific committee, Dr. Hossein Hosni, over the latest COVID-19 developments. She said large number of medical staff members have been vaccinated. Zayed praised the work of the committee in following up on the COVID-19 repercussions, saying it is responsible for approving the vaccines that are being used in fight against the pandemic. For his part, the Scientific Medical Committee Chief, Dr. Hosni, said Egypt was a pioneer in swiftly dealing with the pandemic since the start. He said that the Health Ministry has worked on 3 levels, modifying treatment protocols in accordance with the development, training all doctors on Egyptian treatment protocols, and launching researches and publishing them in medical magazine. He said the Health Ministry aims for 100% recovery level. And our dear viewers, the COVID-19 death toll in Africa surpassed 100,000 on Friday, a fraction of those reported on other continents, but rising fast as a second wave of infections overwhelms hospitals. More details in the following story by Samah Sharif.
Africa's reported deaths of 100,354 compare favorably with North America, which has registered more than 500,000, and Europe, which is approaching 900,000. But deaths are rising sharply across Africa, driven by its southern region, especially economic powerhouse South Africa, which accounts for nearly half. South Africa was ravaged by a second wave caused by a more contagious variant that has jammed up casualty wards. The World Health Organization's Africa office said the increased number of infections has led to many severe cases, and some of the countries really found it quite difficult to cope. The office said they have seen some countries getting to their limit in terms of oxygen supply, which has got a really negative impact in terms of case management for severe cases. The statement by the WHO Africa office chief said the rise in deaths was pronounced in countries near South Africa, like Zimbabwe, Mozambique, and Malawi, raising the possibility that the 51Y.V2 variant identified in South Africa late last year had spread through the Southern Africa region, although more genomic sequencing needs to be carried out to prove that. International aid group Doctors Without Borders this month called for urgent vaccine distributions in southern Africa to counter the spread of the new variant, as most African countries have lagged richer Western nations in launching mass vaccination programs.
And now with this report about the latest developments in the Ethiopian-Sudanese ties, while of course there were some developments on the ground. The clashes erupted between the Sudanese and Ethiopian forces over Al-Fashqa, an area of fertile land settled by the Ethiopian farmers that Sudan says lies on its side of a border demarcated at the start of the 20th century. More details follow.
Sudan on Saturday accused Ethiopia of an unforgivable insult in its sharpest statement since a decades-old border dispute flared late last year. Clashes erupted between Sudanese and Ethiopian forces over Al-Fashqa, an area of fertile land settled by Ethiopian farmers that Sudan says lies on its side of a border demarcated at the start of the 20th century, which Ethiopia rejects. In a statement on Thursday, Ethiopia's foreign ministry said it believes the conflict being trumpeted by the Sudanese government's military wing could only serve the interests of a third party at the expense of the Sudanese people. Sudan's foreign ministry responded on Saturday by saying slander towards Sudan and accusation of being an agent for other parties is a grave and unforgivable insult. It added, quote, "What the Ethiopian Foreign Ministry cannot deny is the third party whose troops entered with Ethiopian troops trespassing on Sudanese land." Earlier this week, Sudan accused Ethiopian troops of crossing the border after a similar act by Ethiopian aircraft last month, both of which Ethiopia denied. Ethiopia on Thursday reiterated its accusation that Sudan had invaded in early November, attacked and displaced Ethiopians, and took control of vacated military camps. In its statement, Sudan said that Ethiopia had affirmed the 1903 border agreement several times, most recently in 2013. It accused Ethiopia's foreign ministry of exploiting the border issue for personal interests and for the specific interests of a certain group. Both countries called on each other to pursue legal means to resolve the border issues. An African Union mediator arrived in Khartoum on Thursday to discuss the conflict, as well as the ongoing negotiations between Khartoum, Cairo, and Addis Ababa over the Grand Ethiopian Renaissance Dam.
The UN chief expressed grave concern on Friday over an outbreak of violence in the Somali capital of Mogadishu. In a statement issued by his spokesperson, the Secretary General Antonio Guterres called on all parties to exercise restraint and calm. More details about the developments in Somalia in the following story.
Gunfire erupted between Somali government troops and opposition supporters during a protest march against delayed elections that turned violent. Demonstrators said the government forces had attacked them first, and residents reported sporadic shooting and that rocket-propelled grenades had been fired. The violence followed fighting overnight that had subsided by Friday afternoon. The political impasse started while lawmakers were due to select a new president on the 8th of February, but the process has been delayed. A statement by UN Chief Antonio Guterres said the Secretary General urges the federal government of Somalia and federal member states leaders to urgently come together and finalize political agreement on the way forward for national elections in line with the 17th of September electoral model. The UN chief also called for the full respect of the rights to peaceful assembly and freedom of expression, and reiterated the UN's full support to the people and the government of Somalia on their path towards peace, stability, and prosperity.
نحن لدينا مصير مشترك.
مصر تسلمت الرئاسة الدورية للاتحاد الإفريقي لعام 2019 وتتطلع كعادتها دوما للتعبير عن شواغل الشعوب الإفريقية الشقيقة الرامية لتحقيق الاستقرار والتقدم ودفع عجلة التنمية قدما. إذا كنتم ترغبون في تغيير وجه القارة الأفريقية، فالاتحاد الإفريقي كقيادة تستطيع أن تعمل وتدرس بشكل مركزي لمشروع عملاق لبناء بنية أساسية على مستوى القارة. أنا أتصور أن الأمن والاستقرار استثمار. إذا لم تستقر هذه القارة والأمن فيها بمعدلاته عالية، هذا الأمر سينعكس بالسلب علينا كلنا.
شعب مصر الذي طالما اعتز بانتمائه لقارته الإفريقية، والذي عاهدتموه دوما رفيقا في النضال والعمل الإفريقي المشترك. انتماء مصر لأفريقيا ليس فقط لاعتبارات التاريخ والجغرافيا، بل هو ارتباط جذور وهوية وعلاقات مستقبل ومصير. وأؤكد على أن مصر تعتزم التركيز على أولويات قارتنا فيما يتعلق بمسائل السلم والأمن، والعمل على التوصل لحلول فعالة لما تعانيه دولنا من نزاعات ومشكلات. مستقبل التجارة والاستثمار في إفريقيا سيكون واعدا مزدهرا، وسيساهم بفاعلية في بناء مستقبل هذه القارة وتحقيق آمال وطموحات شعوبها. إن تحقيق التنمية والذي يعتبر بحق التحدي الرئيسي الذي نواجهه جميعا يستدعي منا تطوير آليات العمل الإفريقي المشترك. إنه لمن دواعي فخرنا ما حققناه ونحققه في مصر على صعيد تفعيل مبادئ التعاون والتكامل الإفريقي، فإن ما نقوم به اليوم يعتبر خطوة رئيسية نحو إنشاء الاتحاد الاقتصادي لإفريقيا. فمصيرنا واحد وأهدافنا المشتركة واحدة، وما يتحقق من خير وفائدة لمصر من شأنه أيضا أن يعود بالنفع والفائدة على كافة دول القارة. إن كافة تحركات الدول الإفريقية تهدف لتأمين مستقبل أجيالنا القادمة. لقد أضحت قارتنا الإفريقية محط اهتمام متزايد من قبل العالم أجمع. تحيا مصر وتحيا شعوب ودول إفريقيا.
And to shed more light about the latest concerning the COVID-19 and its developments, in light of the recent press conference by Dr. Helle Zaid, Minister of Health, we are joined over the phone by our dear guest, Dr. Salah Abdallah, our health specialist. Dr. Abdallah, good afternoon to you.
Good afternoon, welcome.
Welcome, sir. Dr. Abdallah, how effective have the latest steps taken by the Health Ministry with regards to the COVID-19 been in containing the spread of the virus?
Well, of course, COVID-19 now in Egypt, the situation is much, much better than before here and than other countries. The number of infected personnel is decreased, and also the number of deaths is decreased. Of course, there is a great effort has been done to fight or to do their own best against the disease by bringing the vaccines from many other countries and to vaccinate all the medical staff first, because of course the medical staff is the most they are the most people who are affected by the disease. They are the soldiers who meet all the kind of disease in a day, because you know one of the causes of infection is the number of contacts between the person and the other infected persons. So the medical staff, they are the soldiers who are fighting against that disease. So that's why vaccination for all the medical staff, this is the best which happened. And I think the Minister of Health, when they said that they are succeeded in vaccination of the medical staff, this is the number one step in protection against the disease.
Indeed.
Of course, what is coming after that is to find more vaccination for the to the people who are more liable for infections, which would be the old ages and those who have some chronic diseases. And then starting after that, vaccination for all the people until you reach the standard of 100%. Of course, this will take years because, you know, to find vaccination for all the people is not a simple question, especially that many of the countries who are producing the vaccines, they just give a small amount to the other countries. So Egypt, here in Egypt, the government, I think they play a good role to find that amount of vaccines rapidly, and I think they have to do more relations with the other countries to find more vaccinations. And if we succeeded in find a way to develop or to produce the vaccines in Egypt,
Yes.
this will be good for us, and it will help us in affording vaccination for all the citizens.
Yes. Dr. Abdullah, Minister of Health, Dr. Zaid, said that the first phase of the massive vaccination campaign against the COVID-19 is underway in the country. How do you see this very important step?
Of course, this is a very, very important step. And if we succeeded in that, it will be a very great success, because the country who can succeed at least in to vaccinate 75% of its population, this is will be immune country.
Yes.
And so the step is a great step, and we hope that Dr. Zaid will succeed in that, and at least in there will be a schedule for that.
Yes.
Of course, it will take more than 1 year, but if we can start from now on, this will be a very, very good step forward. And what is important is to find the number of vaccines which is enough for the Egyptian people. You know, we are 100 million, so you need doses at least for 75% of them, and this is a very great amount. We hope that the Ministry of Health and the Prime Minister and the government will succeed in affording this great amount of vaccination to the people of Egypt.
Yes. Dr. Salah Abdullah, many thanks for your precious input. Always a pleasure to have you with us, Dr. Salah Abdullah, our health expert. And with that, our dear viewers, we come to the end of this edition of our program Africa Today. Till tomorrow with another cruise. Goodbye.